That's the technique to using nasal steroids or sprays. So you get your nasal steroid spray, you remove the cap, you give it a really good shake. You make sure that it is not a nasal decongestant. I really do not recommend using those because they are really easy to get addicted to if you use them for more than 2 days. And when you try and stop them, they lead to horrible rebound symptoms like phenylephrine, pseudoephedrine, oxymetazoline. I just advise avoid them altogether. However, if you are using a nasal steroid spray, then this is the video for you. So the first thing you want to do is make sure you really blow your nose, give it a clean. If you can use nasal saline rinses, then that's absolutely fine. You want to get rid of all the bogies and boogers so that the medication works on your nasal mucosa and the skin inside your nose rather than just sitting on your boogers. Then you give your nasal spray a shake because your nasal passageways go diagonally outwards towards your ear. So this is my right nostril, it's going to my right ear and it runs parallel to the ground. It doesn't go up, and back, it goes like diagonally backwards. So the way that you want to get this in the right place, you tilt your head forward, you use your left hand for your right nose, aim for there. You're kind of aiming for this point over here, so you're going diagonally out. So you put it in, tilt your head, aim outwards, and then spray it. I'm not going to spray it because I don't need to use it right now. And then you don't want to do any big sniffs or blow your nose or try and avoid sneezing. And you definitely don't want to be tasting it in the back of your throat because if any of those things happen, then it's just a wasted dose. But what you can do is if you feel it sitting a little bit low, is that really gentle, short, shallow sniffs just to try and get it up back into your nasal passageways. Let me know how you get on. Let me know if you have any questions.